say that.
Well, you would. Good evening, good afternoon to our participants here. Welcome to the webinar for our program, the DNPNA here at Roseman University of Health Sciences. We are glad that you all were able to join us on today. We have some very exciting panelists with us this afternoon slash evening, so we're going to introduce each one of them. There'll be some time for each of them to speak a short presentation, and then we'll be able to take some questions from our participants here. So we're excited to have you. So first of all, I do want to introduce myself. I guess I should start there. Dr. Portia Braxton. I am the graduate admissions specialist for this program, as well as our DNP FNP. So if you've spoken to someone or emailed or texted or called or sent up a smoke flare, it was probably me that answered. So I'm glad that you were able to join us this evening. Next, we have the Dean of the College of Nursing, Dr. Brian Oxhorn. Fantastic dean and full of great information and a lot of character and bow ties. So we're glad to have him as well. We also have the program director, Dr. Nathaniel Abitoff. So we're excited to see him this afternoon. And also wealth of knowledge, and excited to be with us here in this webinar. And then of course, Dr. Bradley Stelflug. So we're excited to have him as well. You might have seen him in our other webinars as well, and then may have spoken to him or sent him an email. So we're excited to have you all. I think we're going to start with the Dean, Dr. Oxhorn, if he has any words.
Shall be very brief because I know I'm the last person you really want to hear from. I am not a CRNA. I'm the dean of the college. I've been at Roseman since 2012, and I came here as a faculty and worked my way up a little bit. And thank you so much for your interest in Roseman. It's always, I really do appreciate when students consider us. I think we have a great program. I've been blessed to be able to put together a fabulous team of CRNAs in both Dr. Apatoff and Dr. Stelflug. And then there's, faculty coming on board as we move into what is rapidly becoming almost year 2 of our first cohort, who started in July. And so thank you very much. And again, I'll leave it at that because, again, I'm not a CRNA, so I know you really don't want information from me.
Hey, can you all hear me? I'm Nate Apatow. I'm the program director. I'll tell you a little bit about myself, and then I will give you an overview of the program and expectations for successful applicants. And then I'll let Dr. Stelflug and Dr. Braxton give their 2 cents, and you'll have my 2 cents, and then you'll have all the cents that you need. I was trained as a nurse anesthesiologist in the Army many years ago. In fact, right after I became a nurse anesthesiologist, they invented fire, and then there was the wheel. I've been doing this a while. I have been teaching since 1999. I have a doctorate in neuroscience, as well as a master's of science in nursing and a master's in health science. And I've been training and educating nurse anesthesiologists for about 25 or 30 years. Yeah, that's me in a nutshell. The program at Roseman is about 1 year old, not quite. We accepted our first class in July of this year, in 2024. We have 21 currently. We have 21 seemingly successful students who are doing well, and their didactic portion, we're not going to start clinical until after the new year, when they will start with simulation and then start going to hospitals in the greater Henderson, Las Vegas area, as well as in California and maybe another couple of spots. The program is 36 months long, which is consistent with all the other programs, DNP programs in the United States, leading to a Doctor of Nursing Practice degree. We're an integrated program. However, we're very front-loaded. For the first year, you would take primarily DNP and science courses, and then we would start with simulation, which Dr. Stelflug will go into detail on. And then you'll go into clinical. The great thing about Roseman and there's lots of great things about Roseman, is its 6-point learning mastery model. I'm sorry, 6-point mastery learning model, which is really unique to Roseman University. The beauty of this model is that it's a competency-based model, meaning once you demonstrate competency, you pass the course. There are no letter grades given, because once you meet the competency, we don't care if you're at the top of the competency, in the middle competency, as long as you're competent, you've passed the course. Another great thing about the 6-point mastery learning model is that for the most part, you take one course at a time. You're not juggling 4 or 5 or 6 courses trying to satisfy 6 different professors at the same time. Really, you take one course, you demonstrate mastery, you move on to the next course, which means that each of the courses are very in-depth and that you really get a good sense of what's going on in that course and are able to learn it and really memorize the information until going on to the next course. The only exception to this rule is you'll be taking some courses while doing clinical, which yet you're going to have to do, you'd have to do a lot of clinical. The accrediting body requires hundreds and hundreds of cases that you will get, but you'll have to do that at the same time as you finish up your DNP projects. Roseman University is a health sciences university located in Henderson, and they have a successful pharmacy program. They have a successful dental school. They have a very successful nursing school, and they hope to have a very successful medical school. But if they do or they don't, that won't affect our program. We are looking for the highest quality applicants because you have to be on your game. You have to be a really excellent ICU nurse, understanding your craft, meaning you have to understand physiology, pathophysiology, pharmacology, health assessment, etc. And we're looking for the highest quality candidates because we want to have the highest quality graduates taking care of patients who desperately need high quality anesthesiology care. Yeah, that's Roseman University in a nutshell. I love Roseman University, and although its dean does wear bow ties, I still think he's an excellent person, and he's very supportive of the program. And I love working at the university. Dr. Stelflug.
All right, thank you everybody for coming. I'm going to share my screen here and go through some a little bit more in depth, highlighting some of the things that Dr. Apatow talked about. Here we go. Hopefully.
Notice Dr. Stelflug has a great haircut. He's a handsome gentleman.
Yeah, it's a slight on what my old haircut was if you look at my old webinar. All right, so you should all be seeing my screen. Dr. Braxton, is that correct? Okay. Here we go. All right, so I'm just gonna quickly go through a little bit of what is nurse anesthesiology. Hopefully you've done some shadowing, you've done some investigation. You're not coming into this totally blind. But nurse anesthesiologists can work solo. A lot of them do, especially in rural areas. They're the only practitioner in the county for that rural part of the state. But in the bigger cities, they tend to work in anesthesia teams. Not always, but sometimes. And we do the whole wide range: generals, epidurals, spinals, peripheral nerve blocks, sedations, everything that a physician anesthesiologist does, a nurse anesthesiologist does. We've been doing it an awful long time. We've been doing it for over 150 years. You see on the top picture there that we've been doing it since the Civil War. We got Catherine Lawrence, the first one that administered anesthesia. Sister Mary Bernard Sheridan, she started leading the Catholic nuns to be trained in nurse anesthesia throughout the Midwest. Alice McGaw there, she was trained by the Mayo Brothers. You may have heard of the Mayo Clinic. The Mayo Brothers taught her anesthesia, and back in the turn of the century, back at late 1800s, early 1900s, she published 5 articles, which if you think back at the time that a nurse and a woman published in the medical journals, but they wanted to hear from her. She had 14,000 anesthetics without a single related death, and people were dying quite a bit with that ether drop method. So, and our national organization came about in 1931. So we are not the new kid on the block. We are the old kid on the block. We did come to prominence in the news media during COVID, as you as ICU nurses, you were on the front line, so were the CRNAs. For the most part, anesthesia in the ORs was shut down, but the nurses didn't get to go home. They went and did all the intubations, most of the intubations, and started running the ICUs. So there's about 60,000, probably a little bit more now. This is a little bit of an old stat. I looked this back up today, but they haven't refreshed it. So a little over 60,000 CRNAs in the country. That's the same amount as, well, a little bit more probably than the physician anesthesiologists. And we're heavily represented in the rural areas. Over 80% of the anesthesia in rural counties is done by CRNAs. And then opting out of physician supervision, meaning the state allows the CRNA to be able to do all their anesthesia training, their practice without any physician supervision, 25 states. So we're up to half, and plus Guam. So we're getting there every year. It seems to be another state added to the practice, which is very exciting to see. Here is a map of that. You'll notice Nevada is the only not opt-out state. In the 25, they're counting Utah and Wyoming. They're partial opt-out states, so there's 23 full opt-out states. In Nevada, just so you know, we're going for APRN status, advanced nurse RN status, which is looking really good. And it's the first step of going towards opting out. So where can you work? Obviously, CRNAs, every state, every city, every suburb, every rural area in the country, every hospital, surgery center, plastic dental offices, ketamine clinics, OB units, endoscopy centers. We are very cost effective, and we are being utilized more and more. And legislators are starting to look at state laws now to see why, if the state doesn't allow us in some of these areas, about changing those laws to allow us in these areas to decrease the cost of anesthesia. Where will you be able to work when you graduate? Or will you have a job? Yes, of course you will. The demand is huge. We don't see any end to this demand. This is my experience. As you notice the note down here, we do not guarantee any job employment. We cannot guarantee any job employment. But this whole program was set up by former program directors of other programs. So we've been there, we've done that, we got the t-shirt. We know what works, we know what doesn't work. And we've all had our classes sign contracts before they graduate. We do not expect this trend to not continue. We fully expect this trend to continue throughout your time here at Roseman. This is a 22 stat about what the salaries are. Yesterday, I was doing a hospital site visit with our clinical coordinator, and we went through what one of the groups here in Las Vegas is paying. And basically, when you add profit sharing, retirement matching, the amount of healthcare premiums they're paying, and the 6 paid weeks vacation, all in, that group is paying a new grad $280,000 or $300,000 a year. That's just one example, and that's here in Las Vegas. So the easy part is, have you decided is CRNA is right for you? Now, is Roseman right for you? Let's go a little bit further in depth there. like I mentioned, this program is set up by amazing people. Our amazing dean is the one that had the vision. He's the one that reached out to Dr. McDonough. You see the person in the top there, who has been program director, assistant program director of multiple programs. He's the consultant. We have all followed him. He was my assistant program director. The three of us, basically, Dr. Apatow and myself and Dr. McDonough, have known each other for 30 plus years. And I don't know, Dr. Apatow, you say maybe 7 programs we've led? More?
I don't know. Doesn't matter.
Okay.
Bunch of,
Lots
a
of
bunch of.
So even though it's a new program, we're not going to stumble on those mistakes that new programs do, because we've been there, we've done that. We can avoid those mistakes. And just like Dr. Apatow was mentioning, I'm very excited also. We have the 6-point mastery learning model, and very unique to Roseman. The block curriculum, this is just a small sample of what our students are going to start experiencing when they come here in January. You're going to see that they're going to focus on pharmacology of anesthesiology nursing. That's what they're going to do for 4 weeks. They don't have to worry about dividing their attention to other subjects. They are going to be able to go super in depth into these drugs, learn everything about those drugs and how they work on the cellular level and with different disease processes. So without the divided time, a lot stronger learning emphasis. This is what the biggest, I say, people respond to us. This is the favorite thing that most people say that they love about Roseman, is the block curriculum. Early experiential learning. We try to get you into the clinical site, or what you're going to get. Basically for us, it's the OR early as possible. A lot of programs are what we call front loaded. You learn a lot about anesthesia before you ever get into the OR. That's not the Roseman model. So what we did is, our students are doing their DNP projects, but they also have been in the virtual OR during this first 6 months. And you see our students here, I got 3 of them. They sent me pictures of them using the Meta headset, and in the upper right, the product Sinvana. So they've been doing, putting patients to sleep and working on the anesthesia machine this whole time. So there's not going to be, well, any surprises, I guess, when they start doing their anesthesia courses. It's going to be, there's going to be some familiarity to it when they get here and start taking anesthesia courses. Active and collaborative learning. If you're a shy person, yes, this can be a little awkward at the beginning, but the literature is full of examples of why this is the better way to learn. We are not going to just sit there and give you the answers to the tests, regurgitate information that you already read in the book. We expect you to come prepared to class, and then we're going to do active projects and collaborative. We put you in small groups. Your experience in maybe a CV ICU, you don't know very much about neural. So we're going to pair you up with somebody with neural, maybe somebody with a medical ICU background, because you don't have all the pathologies that you've seen so much cardiac disease. You haven't seen the other pathologies. So we're going to get you into a collaborative team. So we have a lot of peer-to-peer teaching with that method. And as Dr. Apatow said, competency-based. You see on that right side, I show somebody pushing propofol. These medicines are extremely dangerous. If not done right, they can kill. I mean, just not holding back. Do you want somebody that's 75% competent? I don't. I mean, 90% is what we require here. And you should want somebody 100% competent that's doing your anesthesia. So We're the highest that I know about in the country. We're going to get you there with your motivation and you putting in the work. But yes, our students are going to be highly competent when they graduate. And frankly, everybody should be expecting this from anybody that delivers anesthesia. Assessment learning, another one of the points. When we give you assessment, we're going to review it afterwards. We're going to use this assessment as a learning tool afterwards. We do end up giving multiple versions of an exam. That's okay, because we do want you to be very familiar with the information when you are done with that block. There is no brain dumping of information in anesthesia. Everything we teach you in anesthesia is important because it's most likely going to be on your boards afterwards. So any way we can get to reinforce the material, we are going to use. And classroom as a teacher, this is what the typical classroom looks at Roseman. We have been presented with a little bit of a challenge having a traditional classroom, but that's okay. We've kind of overcome that challenge. Basically, like I mentioned before, you're going to read the material before you come to class. You're going to watch the videos, whatever the assignments are. You're going to come to class prepared. And then maybe we're going to pick your small group and you're going to come in front of the class and you are going to be the anesthesia team and we're going to give you a case presentation. Then the rest of the class in your groups are going to evaluate that plan, what's good about it, what's bad about it. Active learning, right? But we're going to be using the information that you prepared to come to class. We're not just going to let you sit there and watch slideshow after slideshow, kind of like what I'm making you do right now. All right, simulation. I go a lot quicker through this. We have state-of-the-art simulation. Been blessed with a lot of funds to get you top of the field equipment. Can't wait to have the students using all this. I found the best equipment to teach all the tasks in anesthesia, and that's what we have in our sim lab. I can't find any product that's better. Otherwise, I would have bought it. And thank you to Roseman for all their support in allowing us to get all this. We do have a high fidelity simulation OR. It's not quite together yet, but it's all coming. And what we're going to do with this is we're going to test you, make sure you're safe to go out and start your clinicals. We're going to use this to test scenarios. I imagine you'd rather test some hair-raising scenarios on a simulator versus being it in the OR on a real patient. We're going to be using it for both purposes. And if you require any extra work, we have this where it can be a lower stress environment than in the OR with real patients. Clinical sites, as Dr. Apatow mentioned, a lot of them in Nevada right now, but we are building a strong force of clinical sites in California. We do have feelers out in Arizona, and we are exploring probably a couple other places right now. DNP project. Not a whole lot of people come to CRNA school wanting to do a DNP project, but it is a requirement. We'll walk you through this. We tend to do this in groups of either 2 or 3. And we try not to make it too onerous. It's a project. It's not a research. You're not getting your PhD. You're not curing cancer. So we don't want this taking up, 2 of your 3 years of study here at Roseman. We want you to get what you need to learn on how to institute evidence-based practice into your practice and to your institution's practice. But that's the end goal. It's not to do research. And again, this just emphasizes what Dr. Apatow said, what we're looking for. You also have to ask yourself, are you financially ready for this? Yes, you can borrow a lot of money. If you're ready to borrow that money, that's okay. That can put an extra stressor on you when you're going through school. And are you emotionally ready? Is your family and loved ones emotionally ready for you to be committed to this program and any anesthesia program? So I'm going to give you my 2 cents on how to get into any anesthesia program. I know there's a whole plethora of videos and academies and all this kind of stuff into getting into nurse anesthesia. I think it can be broken down into 3 things. Know your pathology and pharmacology. We brush upon this in BSN programs, but we don't get as deep as we need to. Re-study this, learn this deeper while you're being paid. When you're on your ICU unit, review the pathology you're taking care for and know what's happening inside the body at the cellular level. That's pathology. And pharmacology, again, what is that medication doing inside the body at the cellular level? Okay. That's what we want to know. We don't want to know how you're taking care of a patient. We want to know that you know what's happening inside the patient. Your grades, if your grades aren't what you think is competitive, I always recommend a shortcut is a GRE. But if you're going to take the GRE, do yourself a favor, buy a study program, take like 4 or 5 practice tests, and go blow it out of the water. Get a great test. Show us that you can take a standardized test and do extremely well on it. You can always raise your GPA by taking 1 course at a time and making sure you get a 4.0 on it. It does take time, but that's another great way to do it. Just telling you, a GRE can be a shortcut to that. And then lastly, show us you're hungry. Show us you want this. Shadow, shadow, shadow. Shadow a bunch of people. Go to conferences, and they actually have at the AANA a membership for ICU nurses. And I think that is about all of mine. Here is the campus that we'll have you at here in Henderson. And I think, oh, I wanted to get this out there. If you have Instagram, you want to follow us, follow this first class going through this year. Follow us on Instagram. There's our QR code. And I'll stop sharing.
Thank you, Dr. Stelflug. So I know we have some questions that are coming in, but just because I talk to you guys like every day, I think the questions kind of boil down into different groups. So what we'll do is we'll go through different groups. So if you have questions for this specific thing, get ready to write it in the Q&A section. So the first thing you guys asked me a lot about is how come the scientists have to be within 10 years? And what specific sciences should someone be taking if they're interested in this program?
May I answer that?
Yes, please.
Okay. Sciences over 10 years tend to be outdated. And if you're going to be successful as a student, you really need to have current information. So it's not that we are trying to keep people who have been out of school a while out of the program. The fact is, we want to enhance your ability to be successful. And what I mean by science is we mean anatomy, physiology, pharmacology, and chemistry are the primary, biochemistry are the primary sciences. If you have most of your sciences within 10 years and one science outside of 10 years, we would consider your application. But in general, you're much more likely to be successful with recent sciences, and we don't require a lab component necessarily.
And another question I get, a lot of students or applicants want to know, do we take credits from specific institutions? So just to clear that up, we are looking for credits from regionally accredited institutions. So you can send me a list of a whole bunch of different schools, but honestly, I don't have the time to look them up. You can search for accreditation for a university or institution, usually on their website. There's a section that'll say about us, and then you can look for accreditation. So that's where you can find that information.
One comment, may I interject?
Sure.
The only accreditation that's important is the accreditation by the Council of Accreditation of Nurse Anesthesia Educational Programs. And the reason that's the most important, because if you don't have that accreditation, you can't take the certification exam and you cannot be a nurse anesthesiologist. And we have that certification, or we wouldn't be having this webinar.
Thank you. And so the accreditation I was speaking of was for those individual science classes. If you're taking,
Oh, sorry, my
no,
bad.
that's okay. We needed to know that too. So that's good. So again, there's another question here, biochem versus organic chem. If you guys want to explain if there's any, like, I think you did cover that. If there's any specific science courses, one versus the other, I think Dr. Stelflug went over, you know, the things that you need to know as far as pharmacology, right? So those different things. So you want to, you know, make sure you're covering that. Here's the deal, guys. I look at applications all the time. People are going to take whatever science classes interest you. If you're going to do well in a science class, take that science class. Take that one. You know, if that makes sense, because, you know, that you want to do well, right? You want to do well. We want to see those science grades that are good, and not necessarily you try to shoot for the moon and take something outlandish and you didn't do well. It's better to do well than to not, right? So let's see, we have some other questions about cure assessment. How is cure assessment graded? That's a third party thing. That is not something that, how can I explain this? If you want to research what cure assessment is, that it is to help reduce bias in admissions. And so that's the reason why that's there. You just want to do your best on it. That's what I can tell you about cure assessment. Okay. Do your best to answer questions as best as you can. What's that, Dr. Upton?
I'm sorry. So Kira has, as Dr. Braxton correctly pointed out, it's got a very specific grading matrix. What we're trying to do is get a sense of who fits the profile of somebody who's going to be successful. Being successful as a program director is all that matters, right? We just want to get people in the profession who are going to succeed, because when you are admitted to a program and you don't succeed, everybody loses. The program spends tons of time and energy trying to get you to the end game, to the finish line. The student puts in time, sweat, tears, moves that from one place to another, and pays a lot of money. So when a student doesn't succeed, everybody fails. So Kira is an attempt on our part to try to get the best people who are the most likely to succeed, and takes out some of those biases that GPA and GREs have that we can't factor out.
Right. And we can't give you, like, I know sometimes people ask me, well, how do I answer it? I can't assist you with that. You know, you just, like I said, do your best on all parts of the application. Don't let any part of the application falter. If it's on the application, guess what? We want to know. So take your time, answer each section of the application thoroughly, because there may be a place where maybe you wrote your, you know, your statement, your personal statement, but you forgot that you had certain certifications, or that you learned something, or you volunteered somewhere. And that's why those sections are on the application. So don't rush through it. Take your time, do your best, and do your best to pick people who are going to do very good recommendations for you. I can't tell you how many people, you know, you pick someone to do your recommendation, they'll recommend you. That's not good. So don't do that. Any other pointers from anyone here?
Be yourself, because you're not going to be able to fake it for 3 years. We're going to find out real quick whether you match up with your application, and then that's not going to go well. And for Kira, don't reset your browser. That pretty much knocks you out of your Kira. It's
interview.
Interview. It's integrity. You can't preview the question and reset things until you get the question you want and all of that. Just be yourself, answer honestly, and you'll just be yourself.
Mm-hmm. We're trying to keep the questions in, like, together in sections, right? So we're still talking about the application at this point. I think there was a question about sciences. So the sciences we're going to look at all of your sciences that you've taken in the last 10 years. If you repeated a course, say you got like a C or a D in a course, and it's within that 10-year period, that goes towards that GPA, that science GPA. So you do want to keep that in mind. I know sometimes people are like, oh, well, these sciences will fall off next year, but then you want to make sure you also thread the needle and have those required sciences, within that time frame. So hopefully that answers your question about that. The next thing that I get a lot of questions about is work.
Can I add something
Sure.
to that? There are a lot of reasons to get low grades, and we try to do a holistic admission. And when you are working multiple jobs or taking care of family and all of that to get through school, we understand that, and that can lead to low grades. And show us what you can do now. That's what we want to know. What can you do now? And that's what I was talking about the GRE. Yes, it's not the greatest test in the world, but it shows us you can study material and pass a standardized test. And that's what our boards are. So it's just one way to show us what you can do now without all the pressures and stuff that you had then that gave you bad grades.
Dr. Braxton, there's a question in the chat about is it the natural science GPA that you're looking at that calculates a nursing CAS?
Oh, I wish it was, because that would make my life easier, but unfortunately it isn't. It would, but it isn't. So like I mentioned, literally all of your science courses that you've taken in the last 10 years, that's what we're looking at. And unfortunately, the systems don't always do that. Because you may see, I think nursing CAS will say, oh, you took this course and you repeat it, and they'll take the higher one, but that's not what we're looking at. So, I try to keep it as simple as possible. So whatever you've taken in the last 10 years, that's what we'll look at as far as that GPA is concerned. But don't give up hope. And I think I've talked to some folks who are like, well, I've been working and I didn't do so well. I was 17 or 15 when I went to school. Like Dr. Selflow said, we understand. But you have to show us what you can do now. So just keep that in mind. And the good news is, hey, we're enrolling for next year, and then we'll enroll for the next year, and so on and so forth. So if you just keep those things up to date and keep working at it, I don't think there will be an issue. So the next thing was about work. So we have a lot of questions about work. There's questions about, can I work during this program, or should I work during this program? Working in the ICU, or what work experience is accepted if I haven't worked specifically in an ICU. And then also there's questions here about if I have previous experience, as an advanced practice nurse, how does that factor in? So those are some questions.
Okay, well, the answer is you need recent ICU experience. It can be medical, surgical, CT. It has to be ICU experience. And it has to be, you have to have worked in the ICU within the last year. If you worked in the ICU 10 years ago and now you work, in cath lab or something else, that's not going to be useful. If working during the program, you can probably work through the first 6 months when you're doing nothing but online courses. After that, if you can work in during the program, but you won't succeed in the program. There's just no time. So my strong suggestion is that you plan on not working and make financial arrangements so that you don't have to work.
Every student I've had that has struggled, they come crying into my office and confessing that they are still working because they thought they were financially prepared, but then felt pressure to not take out as much loans and took a weekend shift, took a Saturday shift. It just can't be done, folks. You cannot work during the last 2.5 years of this program. This has to be your job. It has to be 24/7. And the only time you can take off is for your loved ones. It's not to work.
And that's not just this program. I've been program director in several other programs, and it's all the same. If you work during any program, you're not going to succeed. There's too much information. You have to spend most of your time in clinical. If you work during the program, you won't succeed in the program. So it's up to you.
I just may just make a quick comment on this because I've learned a lot in working with these guys over the past over about 2.5 years now about this whole profession, and some things sort of dawned on me. So I was an ICU nurse by original practice. It's been way too long. I'm not qualified for the program anymore. But the thing about this particular degree in relative to the other profession who does this work, right? So you're going to be a nurse anesthesiologist or a nurse anesthetist, whatever you want to call it. And there's these other guys who are MDs or DOs, and they're anesthesiologists, right? So most of us, we're all nurses, but we had a basic biology that got us into the A&P 1 and 2, and we had a micro. I was of the generation where you had to have a chemistry, and the intro to organic was it, one semester of intro. Right. So, and that's it. Right. And then we come into nursing school and we get through nursing school and we're great nurses and we're incredible ICU nurses. Right. What do doctors do? Most of them have a degree in biochemistry, in biology, in something that probably had about 80 credits of intensive science. And then they go to med school and their entire 2 years is graduate level basic science. And then they do their clerkship years. And then they go off to a residency. An anesthesia residency is 3 or 4 years long, right? You're going to get, and when you're done, what you will do is the exact same thing they're doing, right? There's no such thing as, from like a legal healthcare perspective, there's no nurse anesthesia versus doctor anesthesia. You're all applying the exact same anesthesia. So the depth of knowledge that you have to have is crammed into what is a relatively very short time frame. And so that's why this focus on these science, demonstrating your ability to really understand intensive science concepts, because if you think those were difficult, you're about to enter a whole new world of difficulty, right? It's a very, very intensive medical doctor, for lack of a better term, level of scientific understanding at the cellular level, the physics, chemistry, biology, cell biology, all that stuff, right? And so that's why, it's not just us. So to think I'm going to work through this program, you're not. Trust me. And I have some alumni that went to Roseman that are now out practicing as CRNAs. They got into other schools before we started ours. And they tell me you can't work not only for the content of the material, but the amount of clinical hours. You're going to do hundreds of cases, a couple thousand hours. Again, relative to the other side, what do? They do about 4 times as many hours and probably 4 times as many cases. Yet you're going to be held to the same level of practice standard as the physician anesthesiologist. So I'm not trying to freak you out or anything, but this is just this kind of thing that I understood. God, why are you guys so hard? It's well, because it's a really hard thing you're doing and you can do it. You can do it, but don't plan on working, because you just won't. There's not enough time in a day to be able to work. But by that same token, all those alumni that I've talked to, they said, yeah, it doesn't matter because I have paid off my student loans in my first year of working. It's that, hopefully it'll stay that way for y'all in 3-4 years from now. I imagine it would, but it's kind of like I call crazy money. It's a little bit of crazy money right now. So it's definitely, this is delayed gratification. Grad Plus loans are your new friend.
Well said, Dr. Oxhorn.
Well said.
Thank you for that. So we have gotten a lot of questions about work again. So there's questions if the pediatric ICU counts.
Yes.
As an acute care nurse practitioner, does that add to my admission credit? I don't know what credit you're looking at.
No transfer credits.
Yeah, there's no, I don't know if you mean does that
if
make
I
you
could, because I saw
active?
some of those, so I just want to address that a little bit. You might find some programs out there that, doesn't make you take the 3 Ps again or something along those lines. not Roseman. We're a mastery learning model. It's really hard for us to take the equivalent of what some other institution did and apply it in one of our courses, because not all the courses are necessarily as cut and dry content wise. A lot of stuff is threaded throughout our blocks. That's part of our model, and so it's really hard to sort of do that. And you're getting a doctoral degree, so these are all doctoral level courses, and there's just no way to sort of jump in and out of something and get credit on some private work. Maybe someday in the future we'll be in that boat, but for right now, with this program the way it's designed, they're all doctoral level coursework. The advantage is, if you're a nurse practitioner already, you're going to have at least 3 classes that should be relatively really straightforward for you. And if you're in the group projects and the group testing, your classmates are going to love you because you're going to really know those answers. And you have a slight advantage in that you have a little bit of clinical, higher level of diagnostic clinical skill level than the rest of us who we're just really good ICU nurses. You kind of have a little bit of that edge. But as far as anything else goes, it doesn't shorten up anything for you.
Thank you for answering that. And just as a point of note, working in admissions for a very long time, you see my gray hair. Typically, once you get past the bachelor's level, there's no transfer of credits. It's like a waiving process, and it's next to impossible for those reasons that Dr. Oxhorn stated. It's just not an apples to apples. So that's just in general something to know. More questions about, still questions about work. But also there were questions about how much time should someone spend, or how much do students spend working towards this program? So you're spending a lot of time in didactic, a lot of time in clinical. How is that split up? And then also there was another question here about independent rotations. Is that a possibility? What's the average case volume for a student? Let's see. Does this program cover regional anesthesia? And is there a home base for a bulk of the clinical hours? That's a good question.
So we are going to do home bases. We are right now at, last time I calculated, about 3,500 clinical hours. It may come in a little shy of that. You need 2,500 to graduate. You need 600 cases to graduate. You got to be hiding in the bathroom to not get 600 cases in our program. And so you probably, everybody would probably get over 1,000, but we haven't run people through. So I'm not sure how many big cases. You may do a spine that goes 10 hours and then you only get the 1 case that day. But you're managing blood products all day long and hemodynamics, the whole works. And then the next day you're doing endo and you get 25 cases. So it's really hard to say, but we'll guarantee you that you'll get your 600, but most likely you'll get a lot more than that, but it's depending on your motivation. If you are a clock watcher, yikes. Don't do that. Don't, there's other programs for that. Roseman students don't do that. Roseman students go searching out for opportunities. And we are in a lot of clinical sites where there are very sick patients and we do very awesome surgeries. Regional, Henderson, the CRNAs are doing all their own blocks. And so we're going to get students through there. Sunrise, we can do our own blocks. And
there's a course in regional anesthesia. We teach a course. An entire course is dedicated to regional anesthesia as well.
I teach that, yes. And I have a lot of simulation products. If you look up Intelligent Ultrasound, we have their products. So you can practice that before you even go out there. But Riverside in California is another place where the CRNAs are working independently, doing their own blocks and all of that. So we are, again, haven't run the students through, so I can't say for certain, but we do expect to have one of the larger number of regionals in the programs across the country.
We started the program in July of this year, so we're not sure what the numbers are going to be, and they'll be adequate. They'll be more than you need to graduate, but students may have 300 or 400 more cases than required. But all that matters is that you get the minimum number of cases that are required. But we can't give you a good number at this point.
Yeah, there's a question about organizing tracking clinical experiences. So that's a shared gig, right? There is a clinical operations coordinator who's a CRNA in our community who works for us. It's a dual appointment with the large anesthesia group in town, and so it's not like NP schools, which I wish they were like CRNA schools. You're going to be told where you're going and what you're going to be doing, right? You do not have to go, I want to go here, or I found this person I want to work with. It's not like that kind of education. It's much more directed. We're putting students in the places they need to be in to get the cases they need and the types of specialties they need, because again, our accrediting body requires that you have very specific experiences to be qualified.
Now,
We'll tell you what you need to know and where to go.
Yeah.
All you have to do is show up ready to learn.
Yeah.
now that being said, we've already asked this first class what hospitals they came from and if they're open to taking students, and we'll do that with pretty much every class. And if there's a hospital that our seniors are looking at taking a job at, I'm more than happy to call them and ask if they're willing to take students. Who knows? That may become a clinical site to where you're doing a senior rotation. No promises, but that's just something that clinical sites are always going to come and go, because situations at every hospital come and go. We can't dictate that. Situations change on the daily, but we can always access your connections to try to keep that full and dynamic.
Thank you for answering that. We had some more questions about scheduling. So like breaks in the program, if there's scheduled breaks, things of that nature. I don't know if you want to discuss remediation.
Oh, and then there's the wellness, that you guys should talk about the wellness stuff that you guys have.
I'll just mention real quick, Roseman's calendar schedule, which we do follow, gives you 3 weeks off each year. And we do have a process if you need emergency time off. But if you're scheduling stuff, we get 2 weeks in December and we get 1 week in July. And that's the academic calendar. So you can plan things, 36 months out. You'll get 9 weeks off during your 36 months here. And then Dr. Apatow, you want to talk about Cheyenne?
Sure. So one of the things that we identified that we wanted to make happen in a new program was student wellness. And we believe that student wellness is very important. There's tons of research that show when students are taking care of themselves, mind and body, they're much more likely to succeed. So we have hired a full-time student wellness monitor. She is in the process of instituting a wellness program, and students are going to check in with her. We're going to do our best to help with students maintain their own fitness, their own their body and mind as best we can, given the constraints of time with the program. But it's important for us, and we've got a really great lady filling that role, and she's going to be great helping us. It's going to be amazing. It'll be amazing.
And she has the master's in psychology, correct?
Yeah, she's had previous academic experience. So I'm very excited. Cheyenne Cuizan is her name, and she's awesome.
She's already organized a student and family outing for the second day that they're here.
Yeah,
Just kind of back, if I don't mind just interrupting here, because I'm just kind of reading chat questions here. So if you become a student here, then you're going to be a part of this CRNA family, right? And so you're going to have working with Dr. Stelflick, Dr. Apatow, Dr. Reed. was another rock star in the country, is a fascinating individual. Just to name a few, Dr. Pavolate. So if you have a facility, again, where you're at or where you were coming from, and you kind of really think like, I'm not going to stay in Vegas. Like I know this, like I want to go back home to my family and work there. Then that would be the first step, is just to work to provide that information to them. I can tell you the process for this is, again, very different than the undergraduate world, and certainly very different than the nurse practitioner world, where it's pretty quick. I can get a clinical place in undergraduate. The facility says, yeah, we'll take your students, we'd love them. Okay, so we just signed on the dotted line. This is actually starting with the anesthesia providers, right? Because they are the ones that are going to be precepting and teaching you. So they have to be on board first, and they have to be willing to take a CRNA student. And then I have to go to the hospital and say, are you willing to let CRNA students in your facility? And if so, who do I talk to for that affiliation agreement? And then if it's a regional or a corporate institution, like HCA, for example, which is nationwide, it's a divisional Far West contract. I have to go to each individual hospital to have somebody sign that they are aware that their division vice president agreed to take CRNAs here in Las Vegas, right? And then we're not done yet. We got to take all the caseload information back to the COA, the accrediting body. And we have to ask them, present all this stuff and say, we are asking to add an additional clinical site. And then they got to come out and physically look at it to make sure, is this really a hospital with an OR that has anesthetic gases, which is fine. It's rigor. It's a very rigorous program at all levels, which is good, because you're entering a profession that should not ever hang its head that you guys are not like fly by night. You're not just kind of winging it. Oh, we can put people to sleep. You're very, very rigorous from the formation of the program all the way through to the practice itself. Very regulated, very rigorous. And so my point is that's a good thing, and we'd love to expand, but just understand it's not as simple as like, hey, I got the CRNA buddy up here, in wherever, and he'll precept me. There's a lot of steps between that. And we'd love to do that, because the idea is to expand to where the student body really wants to end up being, right? Because if I bring everybody here to Vegas and nobody stays in Vegas, we'll last about, I don't know, not very long, right? Because you don't want to train people that aren't, you guys, these anesthesia providers here are dying for help. They are so short-staffed here in Las Vegas and other places that they do not want to spend 2 years, because it's really a full 2 years of clinical, and have nobody stay after that. That's a lot of resources. So that's why that's important for that. So we are happy to do that, but that'll be kind of one of those things that you get here where you're a student, you meet with Dr. Apatow, Dr. Stelflug, one of the other CRNA specific faculty, and have that conversation to help with that sort of expansion.
Almost every program in the country has a lot of travel. I'm starting to see questions, do I got to keep coming back to Vegas? The answer is, if the class is live in Henderson, you will be in the seat in Henderson. And that mainly for the anesthesia courses and the anesthesia principal courses. We haven't nailed down exactly all the timeframes, but there are going to be long extended periods where you're going to be on clinical time, and then the courses will be done online. And that's when you will be at your clinical site and not required to be in Henderson. We are going to try to minimize travel, but to Dean Oxhorn's point, you're a California person, Las Vegas has no appeal to you, you have no family in Las Vegas, California is where you want to be. Why would you not want to explore our clinical sites in California and see where you fit? Because every anesthesia group has its own personality, its own kind of work frame. Why would you not want to work in all of those and see where your personality fits the best?
That's very good. We have a lot of questions here about interviews. When will they happen? How long will an applicant hear back as far as when they complete their application? The application closes in February, just so everybody is clear, because I saw that question a few good times. And then also there's a question here about what are we looking for in a BSN? And I think, I want to say, was it Dr. Stelford or Dr. Apatow that answered that question about the accreditation that we're looking for?
When does the application period close?
February
February.
15th.
Mhm.
February 15th. Okay.
But let me just say this, because this question says, I'm considering the cheapest online programs. Okay.
It's in a BSN completion program.
Yeah. Does
So,
anybody want to answer that?
I mean, well, maybe I should let the CRNAs answer it. We tend to be holistic, right? It's a part of a big package. You can't just say, well, I did my RN to BSN at Stanford. I don't know if they have a program there, but like, it's not gonna be like, oh, awesome. You know, it's about, you know, the other pieces. What's your ICU experience like? What were your science grades like for the ADN portion of things and those kinds of prerequisites? What all those other components that they tend to look at. It's not one single factor, but it does have to be accredited, which I'm pretty sure most RABSNs are, because otherwise you wouldn't. It's got to be CCNE or ASIN accredited.
Mhm. Okay, and then the question about the interviews, will there be interviews on a rolling basis? Or will everybody be assessed after the deadline?
Yes, everyone will be assessed. We're not doing rolling interviews. I've tried that. It's no fun for anybody.
It's not fun. And then also are the interviews in person or online or virtual? rather?
They're going to be in person unless you have extreme circumstances. You took a trip to Mars and you can't get back in time, but you'll be able to start in July. If you're on Mars and you can't get a rocket back, that then we'll waive it. But for the most part, we want to see up close. We want to be able to get figure out who exactly you are.
Remember my third point, people, motivation. Show us you want this.
Okay, and the GRE is again not required for this cohort.
It is not required. I was just mentioning that as a quick way to show us that today, without all the stuff that hindered me back in what, 2015 or 2012, or whenever I had those grades that I don't like, because I had 2 jobs or whatever, that kind of thing, was whatever happened that gave me bad grades or the grades I don't want. Show me what I can do now. The GRE is a shortcut, but don't go take it. Study for the darn thing. Take practice tests. Go blow it out of the water. Show us what you can do now.
I want to add on to Dr. Stelflug's comment. If you've got a bunch of grades that you're not proud of, then I would take the GRE and kill it, because that's the only way you're going to get into our program or any other program. It's hard to get in with bad grades because your chances of being successful in a program that's as rigorous as this one, and really any anesthesia program, you're better off if your grades don't represent your abilities. Take the GRE. It's not mandatory, but if you want to be a successful applicant, I would take the GREs.
Right. And that's why it's still in the application. If you want to upload a GRE, then you can. So that's why it's still in the application, but it is not a requirement.
But if you take it, study. If you take it, study for it. Don't take it cold.
Yeah. That's a very good point. Let's see. Canadian accredited. Okay, so we're looking at your BSN. This question, what if you went to a school, you did your ADN, it's not accredited, then you did your BSN at accredited institution. We're looking at your BSN. Hopefully that answers your question. But yeah, okay. I think that's about, there was one other question about student supporting each other and being able to debrief. And so I don't know if you want to talk a little bit about remediation or what that looks like, because you mentioned the 90%, and I know sometimes that does scare individuals. I don't know if you want to discuss that at all.
Sure. The Roseman program is a mastery program, so that getting 90% is going to be achieved by everyone. For those individuals who can't achieve 90%, We're going to work with you. We're going to come up with a plan. You're going to have extra faculty time and be given the opportunity to get 90%. It may sound daunting, but the Roseman model works. And I don't just say that because I'm a Roseman employee. The dental school is wildly successful. The School of Pharmacy is wildly successful. And the School of Nursing is wildly successful. They've used this model over the last 10 or 12 years, and it works. It worked. Graduates of the Roseman's undergrad program know the 6-point mastery learning model and 90% competency, where you get individual attention and you're not having a lecturer stand up there for 6 hours going yak, yak, yak. It works.
Does work. And I will say this as someone who works with grad students, a lot of times the students that I see come into Roseman are people who were preceptors for our undergraduate students. And they see how competent our students are. They're confident. They know what they're doing when they come in. And when they graduate and they go into the field, they're like, where did you go to school? You know, because that's one of the things, you know, you can go to school to be a nurse and then get in the field and I don't know what to do, freeze up. And that does happen. But what I've heard about our students is that they are ready to go. The second they are finished, they're ready to go. They know what they're doing. They are confident. They're not in the way. And so I can definitely attest to that with the 6-point mastery. And listen, guys, it's a doctoral program. It's going to be rigorous. And everything that we're saying to you as far as the application and what we're looking for in a student is not to exclude people. It's because we want to make sure if you're in our program that you are successful. There's no point in you getting into our program and you don't do well. Nobody wants that. Nobody wants that. So everything that we're telling you is to make sure that you are well prepared to do what it is that we need you to do to be successful. Because when I say this institution wants you to be successful, that is what I mean. And so if we say you need the sciences, you need the experience, it's because we want you to be prepared to do well in this program. We don't like to have people flunk and fail. That's not it. There's no pride in that. So let's see. Any other questions? I don't see any other new questions in the Q&A or the chat. So last chance to speak up if you have any other questions. This is recorded. I think it'll be on our YouTube. Let's see, we got a message here. Let's see. Okay. Wow, biochemistry accredited. I don't know what that. I don't know what
That's
that
not a question. That's not a real question. I don't know what that means.
Schools are credited, not content, but where did you
Not
take your
all
biochemistry?
courses.
Yeah. So
What
some
about
of you
the-
may have specific individual situations, and that's what Dr. Braxton is there to help you with your advisory reviews and asking some very specific things. But I think overall, this was kind of intended to provide an overview and questions about maybe the profession and, again, about the clinicals and how those kinds of things work and the rigor, and again, I can't stress the rigor enough. Again, having worked with these guys for a little while, I've only been on the receiving end of anesthesia. And I love my nurse practitioners, but we all know if you're in an office and you don't know kind of what's going on, you can excuse yourself for a minute and go consult with the physician or go on your little up-to-date app and come back and make your diagnosis and prescribe. In the OR, that patient crashes on you. You don't get to look at the surgeon and say, what do I do?
What now? Exactly.
They are absolutely,
Exactly.
that's not, they're
Exactly.
like, I'm like, you're the anesthesia. I'm an orthopedist, man. You got to figure it out. Now, does that mean you're not going to have assistance? Of course. These guys, I mean, it's a team effort in the OR, and even physicians have patients that crash and they need help. They need assistance, but the point is that that's on you. You are in charge of putting me to sleep, which is easy enough to do, but you are more importantly in charge of waking me up. And I would really appreciate it if you all do that. But
Yes, thank you.
you're here, you're type A ICU nurses. And so, you're in the right spot. If this is the career path you want to do, you're doing the right thing here. Right. And so keep at it. Whether it's with Roseman or any other institution, keep at it.
And also, I do want to say we do not have any, what is it called? Campus tours for this program. Generally speaking, that's, we don't take anyone into any areas, where there's teaching involved. That's due to federal regulation. So FERPA, we don't do that. Also, I'm not there. So, but yeah, but if if you have just general questions about the program, of course, you can always reach out to me. I'm available through text, email, Teams, calls, all of that good stuff. So I do my very best to get back to you all with any questions that you may have. Let's see. I think we pretty much answered most of the questions. There were some questions about the fees for the applications. The nursing cast sets their own fee, so that's separate of us. The supplemental is set by us. That's a $40 fee for that. If you are an alum, you can signify that you are an alum in the application, and it will give you a waiver code for that. Let's see. How many people apply for this program? A lot.
Yeah, hundreds apply, 100-ish
Yeah,
interview, 20 got in.
yeah, a lot.
Our admission will be 25 this year. It's
Oh.
kids, it's a rigorous program, and obviously it's highly competitive across the nation. And I've had many Roseman graduates before we started our own program, who I, wrote letter after letter, and some of them, it took them 3 years to finally get accepted to one. It's a competitive discipline to get into. So,
But wait a minute, we just got okay. Now the tuition. Okay, thank you for putting that in this chat. Let's talk about that. The tuition that's listed on our website is for 1 academic year. This program, 3 years. Okay, so that tuition and fees is listed for 1 academic year. So if you can do the math, you can do the math, and you'll see that it has to break down the tuition, the fees, things that you can expect within the program. You may be expected to purchase additional things later on in the program. So, you just want to keep those things in mind. This will also be reviewed with you if you're accepted for an interview. They'll go over that, when to expect to be at the campus, those different things as well. So you'll learn more about that. But just keep in mind that tuition that's listed is for 1 academic year. As it's stated, it gives you the academic year, and then it gives you a breakdown of what to expect for that year. I think that's all the questions we have. I do want to give our panelists the opportunity to have closing statements. We can start with you, the director here, Dr. Apatow, if you have any.
Yeah, enjoy Thanksgiving. And if you're smart and you're at the top of your ICU game, we want you. If you think you might sort of like to do it, but you're not sure, then you shouldn't waste your time and apply. We need people who are highly motivated, that want to deliver excellent anesthesia care to patient population. The patients are all that matters. None of this is about me. None of this is about Dr. Oxhorn, Dr. Braxton, Dr. Thelflug. It's all about taking good care of patients. So if you think you're up for the task and you want to work hard, we want you.
Thank you for that. Dr. Stelflug?
Don't get discouraged. It's tough to get into anesthesia school, just like Dean Oxhorn was saying. I would say the vast majority of people that get into school have applied 2 or 3 times, sometimes 5 or 6. Apply to multiple schools. Never give up. If this is your dream, never give up. Keep applying. It doesn't mean you're not qualified. You're going against whoever applied to that school at that time. So never give up. Keep making your application better. Keep bettering yourself, and keep applying.
Thank you.
And I just want to say thank you all for taking the time. And again, I do appreciate when anybody considers Roseman for any of our degree programs. And so, thank you so much. And that's it.
Well, thank you all for joining us. You will get a short survey once this is over. Please fill it out. It's for our benefit, so we know, what information you need to know after this. We definitely appreciate you coming this evening, and we hope to see you in the future.